a sensory motor disorder that can be classified as a primary disorder or as a disorder that is secondary to another condition. The physiological process of restless leg syndrome as a primary disorder is not yet completely understood. It is classified as being idiopathic, which means that there is no known cause. However, there is a strong connection with brain iron deficiency. As far as restless leg syndrome as a secondary disorder, it is usually associated with renal insufficiency, pregnancy, iron deficiency, anemia, diabetic neuropathy, and Parkinson's disease. Though its primary cause is unknown, researchers suggest 5 gene variants that often will have a greater chance of affecting someone with the disorder. One theory is that an unbalanced amount of dopamine can cause restless leg syndrome because, as a neurotransmitter, one role of dopamine includes the regulation of muscle movement. Another theory is that women are more likely to develop restless leg syndrome than men because women are more likely to have low iron levels, which is often a factor contributing to restless leg syndrome. Another theory is that low levels of ferritin can cause restless leg syndrome in older adults. People who receive dialysis for kidney dysfunction and people with diabetic neuropathy have also increased risks for developing restless leg syndrome. And lastly, many drugs are known to stimulate the disorder, such as caffeine, alcohol, nicotine, Benadryl, sleeping pills, prescription antidepressants, and anti-nausea medications. People often make the mistake of associating restless leg syndrome with jittery, bouncing leg movements that people tend to make when they are nervous or excited. In order to distinguish restless leg syndrome from these other nervous habits, the Restless Leg Syndrome Foundation has been working on changing the name from restless leg syndrome to Willis-Ekbom disease. Common symptoms of restless leg syndrome include discomforting feelings of restlessness and distressing sensations in the lower legs. People with this discomfort often describe the symptoms as tingling, itching, stretching, or prickling deep in their legs and usually below the knee. In extreme cases, some people experience these sensations in their arms as well. Symptoms of restless leg syndrome have a circadian pattern and tend to start at the end of the day and peak in the evening around that time.
And Sarah's going to take it from here with
treatments, some medications, and some home remedies. So treatments for restless leg syndrome include prescribed medications and over-the-counter drugs and home remedies. Doctors commonly use medications for Parkinson's disease to treat restless leg syndrome. Requip and Mirapex are usually prescribed for moderate to severe RLS. They reduce the amount of motion in the legs by affecting the levels of the chemical messenger dopamine in the brain. Nupro, which is applied as a transdermal patch, is also being used to treat restless leg syndrome. Many people find it easier to treat their RLS at home with over-the-counter medications such as Tylenol and NSAIDs. Other ways to control restless leg syndrome is to stop smoking, avoid caffeine and alcohol, drink plenty of water throughout the day, and exercise and stretch the leg muscles. Taking a tablespoon of apple cider vinegar at bedtime and even including a potassium supplement into the diet have helped some people. Many people with restless leg syndrome have reported that putting a bar of soap under their bed sheets mysteriously works. Some experts have found also that people who suffer from restless leg syndrome seem to have cold feet, so wearing socks at night might be helpful to control symptoms.
And
there's the soap again. You would like that.
Do you want to grab this side and I'll grab this side and we'll go over it together?
Sure.
Okay. So what do we got here, Tina, with the pictures?
We have your bananas for your potassium, your apple cider vinegar, and over here we have the water and the ivory soap to put under the bed sheets for the mysterious reasons. We have no clue, but home remedies. And then over here we also have the medication therapy, as well as over here we have the home remedies. And then these are some charts that deal with, let's see,
impact of restless
scores
leg
of
syndrome and
patients
daytime
with-
function?
Oh yeah, the daytime functioning, and then this one also is the scores with patients with common chronic medical conditions who also have restless leg syndrome.
And I'll go over this chart real quick since I'm closer. But generally, participants at risk for restless leg syndrome have fatigue as the highest impact of restless leg syndrome. Second would come in driving drowsy, which is incredibly unsafe. So that's why when you have restless leg syndrome, it's incredibly important to try to seek help, whether it's through CVS and getting safe home remedies such as ivory soap under the bed sheets, whatever works. But you don't want to be driving drowsy and being fatigued. It's going to hurt your exam grades. It's going to hurt your work. And right here, next, late to work, missed work, errors at work. And as a nurse, you don't want to have errors at work. So if you're a nurse and you have restless leg syndrome, probably need to start drinking some apple cider vinegar, some bananas, some water, and some, well,
Putting
maybe.
this up under the sheets.
Maybe. We'll cover that. But lifestyle and home remedies over here by the Mayo Clinic staff. There's stuff like take pain relievers, try baths and massage, apply warm and cool packs, try relaxation techniques. But a site like the Mayo Clinic staff, it has a lot of helpful things that people who have restless leg syndrome can look for help for. So there are things out there, and there's even a site for restless leg syndrome. I believe you touched on it, the International Restless Leg Syndrome Society, who are also trying to change the name to Willis-Eichborn disease. But there are sites, your doctors can help you. There's places like CVS, and generally, like I was touching on in my video, genetically, your family members have probably experienced restless leg syndrome because it's a higher probability that you're going to experience it. There was even a test with twins where and that's in the article that we gave you guys, but basically with these twins, if one twin had restless leg syndrome, probably about 8 times out of 10, if I'm remembering the article right, the other twin had it as well. So you can even look at your family for support if they have it, which they may have, not saying positive, but their support so you're not experiencing these impacts that could really negatively impact your life when you don't really need to have to deal with them, because there is help out there. But, and over here, over there are common medical conditions such as diabetes, osteoarthritis with hypertension, and depression. Those 3 are the most common conditions that are related to restless leg syndrome. So, getting help with those other things, such as depression, diabetes, and osteoarthritis, that can also help you. So no matter what happens, you want to get help for whatever your diagnosis is, and you want to speak to a doctor, whether it's restless leg syndrome, osteoarthritis, depression, or diabetes. Anyone else want to share?
Any questions?
Any questions?
Very good.
Well, good job, guys.
Very good.
And thank you, Tina.
The video is now ending.